Hi, I'm Dr. Manjunath Kodihally. I'm a consultant orthopedic surgeon with a specialization in arthroscopy and sports medicine at Fortis Hospitals. Today, I'm going to speak on meniscal tears. So, first, how do you know that you have got a meniscal tear? So, there are two symptoms, main symptoms of the meniscal tear. You'll be having a sharp pricking type of pain around the joint line, and the pain increases while bending, while squatting, and you will not be able to climb the stairs. Second most common symptom is a locking of the knee. So your knee get locked. You'll not be able to straighten, or you're not able to flex beyond the locked position. These are the two symptoms we get in meniscal tear. So we'll try to understand what is meniscus. Meniscus is a rubbery structure between the thigh bone and the shin bone. I'll just show you the knee model here. So this is a thigh bone, this is a shin bone. You're going to see shaped structure on the either side. As you can see, it's thickened on the outer side. As you go towards the central, it's thinned out like a paper. And the meniscus, which is on the inner side of the thigh, is known as medial meniscus, and the outer side of the thigh is known as lateral meniscus. So how does the tear happen? The tear happen in a young patient. It needs a significant force, wherein you just rotate your knee with a pivotal shift, or if there is any trauma to the knee, the meniscal tear can happen. And in an elderly patient, it need not be a tear. It can happen due to the degeneration. So what is how you are going to diagnose whether you have a meniscal tear? So one is the symptoms, the pain, and the locking of the meniscus. When you come to us, we do certain tests. With the clinical examination, we'll be able to assess that you got a meniscal tear or not. So apart from that, the most common, the important diagnostic tool to confirm our diagnosis is MR scan. We do take X-ray certainly, but X-ray will not show the soft tissue structures. It's only to show you if you have got any degeneration in the joint line, which can contribute for the meniscal tear. So then once we confirm with the MR scan, depending on the tear, next comes the treatment part. So do all tears need surgery? No. Only the symptomatic meniscal tear is the one which needs surgery. Not necessarily all the tears needs to be operated. So what are the surgeries? So surgeries is the most commonly done surgery is a meniscectomy. It's a balancing meniscectomy, wherein the torn part of the meniscus, which is not useful and which is contributing for the pain, will be removed, and the edges are smoothened so that the further tear should not happen, and the further extension of the tear into the normal meniscus will be avoided. And in certain tears, wherein the tear is in the outer structure, at this part, if it is a big tear wherein the other part is intact, we do repair the meniscus. So because only this outer part has got a blood supply, so if you repair it, that will heal. The inner side doesn't have blood supply, so that's the reason why we go for meniscectomy instead of repairing the inner side. So the rehab protocol depends on whether you have undergone meniscectomy or meniscal repair. If you got a meniscectomy done, you will be up and mobile in the next day itself. You will be discharged after take care surgery. You will be discharged next day. So then you will be up and mobile, and you can go back to your sports activities within 4 to 6 weeks. And if it is meniscal repair, you will be put in rehab, post-op rehabilitation for 6 to 8 weeks, and you can go back to your sports activities in 6 to 8 months. So usually the surgery for the meniscectomy lasts around 15 to 20 minutes. The meniscal repair, depending on the type of tear and depending on the extension of the repair we are going to plan, it may take around 60 to 90 minutes.